Okay, good morning, everyone. Thank you for joining today. So this is the last of our 4 PSE trainings for fiscal year 2020. And today's topic is on Create Healthy Stores. And again, I'm Casey Coombs. I'm the Assistant Director of the program. So today's presentation will talk about the program goals of Create Healthy Stores. We'll look at identifying eligible stores, the key elements that have led to successful interventions for our program as well as for other programs, how to get started once you've identified that store. We'll look at all the available resources that you can access in a variety of different locations. We'll talk about where and how to access them. We'll look at some implementation stages. When you're working in retail settings, there's different things to consider than when you're working with schools or food pantries. And there's a process that seems to be the most successful, so we'll look at that. And then finally, we'll finish with how to report your work in PEARS. So the goal of Create Healthy Stores is to create store environments in low-income areas where healthy choices are available, visible, and appealing. And when we were looking at identifying the different PSE strategies for our state, we did a community needs assessment a few years ago, and one of the commonly reported requests or gaps in nutrition access were options in healthy options in smaller corner stores or convenience stores. So identifying that gap in nutrition access was step one, and then we started to look at some interventions that had some research behind them to show why these types of things are important. And some of the main reasons why creating healthy stores is important is because people's proximity to convenience stores within a neighborhood is associated with higher rates of obesity and diabetes. Teenagers that live near convenience stores have higher body mass indexes and consume more sugar-sweetened beverages than those who live far away. And corner stores tend to sell very few healthy items, including things like fruits and vegetables, whole grain products, low-fat dairy. So you can see that obviously it isn't a cause and effect relationship. It's not because they live by these convenience stores. There's lots of different factors there. But because we know populations that live in close proximity to convenience stores and have convenience stores as their main food store outlets, they have higher rates of different ailments that can be improved or even prevented with nutrition, with healthy food access. We also know that store-based interventions work. There's been quite a bit of research done on small corner store and convenience store interventions. And we know that successful interventions tend to increase the sales of healthy foods. So you can imagine if you're working with a store manager, that's going to resonate a lot with them. If you say these types of interventions nationally have shown to increase the sale, which would mean increased revenue for them. Increased customer knowledge about healthy foods. So when you're looking at it from our program's perspective, that's one of our goals, is to increase people's knowledge about healthy foods and healthy lifestyles. And then we know that when store-based interventions result in increased shelf space for healthy foods, there's an increased purchase and consumption of those items. So those are all the goals of our Create Healthy Stores program. I have a little video here. I don't know if I've ever linked out in Zoom, so hopefully it will work. Can you see that, or do I need to switch the share?
I think you need to switch the share.
Okay. How about now?
Yes.
Okay, great.
We can't hear it when you muted yourself, Casey.
Bloomberg School of Public Health in the Center for Human Nutrition and Global Obesity Prevention Center. And for the last 20 years, I've been developing, implementing, and evaluating interventions to improve the food environment for low-income minority populations around the country and internationally. In most low-income communities in the United States, in both urban and rural settings, what we find is that there are far fewer supermarkets or grocery stores. As well, the prices are often higher in the food sources that are available, and the selection and quality is lower in supermarkets that are present in low-income settings. Much more common food sources are small retail establishments such as corner stores, convenience stores, bodegas, and so on. I will be referring to these small retail establishments as corner stores, but keep in mind that they may be called another name in your community. Corner stores within a community are a convenient stop to purchase food and beverages. In some limited resource communities, corner stores are the only place to purchase food and beverages without traveling. In some rural settings, as far as 20 miles to a supermarket or a grocery store. Although convenient, corner stores are limited in space and inventory and typically lack fresh fruits, vegetables, low-fat dairy, and whole grains.
Hi, I'm Dr. Chris Sneed. I'm an extension specialist with the University of Tennessee Extension. I work with our SNAP-Ed program, TNCEP, the Tennessee Nutrition and Consumer Education Program. And I've been working in the food environment area for the past 4 years, helping increase access to healthy foods among our low-income populations. Corner stores are ideal settings for PSE approaches because they are a common food source in limited resource communities. Both adults and children frequent corner stores, whether it be to purchase foods to prepare meals or a quick snack after school or work. Because corner stores typically lack fresh produce and other healthy foods, this can present a major barrier for SNAP-Ed participants who are learning to make healthy choices in SNAP-Ed nutrition education classes. Partnering with SNAP-Ed qualifying sites to implement PSE approaches may provide a place for direct or indirect education opportunities, increase community members' access to healthier foods, and may result in increased sales for the store owner. Having healthier options accessible in the corner stores and displaying these healthier foods and beverages in point-of-purchase areas are an example of environmental changes. But systems and policy changes can also be employed to enhance the sustainability of your healthy corner store initiative. For example, a systems change could be facilitating partnerships with small store owners and local farmers. Another systems change could be facilitating partnerships with food distributors, encouraging them to have healthier food choices available for stocking. A policy change could be working with corner store owners or stakeholders to establish healthier store policies.
Engaging the community and corner store owners to buy into your SNAP-Ed programming or efforts takes strategic planning, patience, and creativity. After studying corner stores and implementing various policy, systems, and environmental change approaches, we've come up with a set of tips and strategies to help others create sustainable change towards obesity prevention efforts in a small retail setting, such as corner stores.
Okay, I'm just gonna switch back. So I like that video because I think it gives a nice overview on why corner stores or healthy stores are important interventions, as well as just a little bit of a overview of the different types of work you can do in a store. And we used a lot of Dr. Gitelson's resources in developing our Create Healthy Stores PSE intervention. And that's actually one of, I think, a series of about 4 videos that are available through this website here on the work that they were doing in on the East Coast in Tennessee and in Maryland. So feel free to check those out for some more ideas as well. So back here, identifying a store. So as they talked about in the video, obviously we have to identify eligible stores before we approach them. We wouldn't want to approach a store and then find out that they aren't eligible for our programming. So the very first thing you need to look at is, are SNAP benefits accepted? They absolutely have to be accepted in order for us to do our PSE efforts there. That's the #1 requirement. After you've identified that, you want to look at the location. Talk to your class participants or just be observant in your communities of where our priority populations are shopping. If it's something you're not particularly familiar with, you can use the your eligibility folder on Box. Look at the census tract data in your communities to find out where the best place is to target the people who have the lowest incomes. When you identify those stores, those are the best places to be working. Also looking at places that are food desert, or a new term are food swamps, where maybe there's a lot of convenience stores available. So it's not necessarily that people don't have access to food, but they don't have access to healthy foods. They have access to a lot of the highly processed, high calorie, high added sugar convenience foods. Those are referred to as food swamps. We always ask that you do reach out to our state office, reach out to LaCee Jimenez to make sure that the store you've identified is eligible. Even if you're pretty confident that it is, reach out to us to make sure. If you're looking at larger grocery stores, which we'll talk a lot about the limitations of working in the larger grocery stores, but there is a requirement that they process at least $50,000 of SNAP benefits per month. So you can imagine those are going to be retailers like Walmart's or Kroger's, Smith's, some of those bigger stores. In a lot of our rural areas where you may just have one associated grocery store, chances are they're not going to come even close to that $50,000 redemption. And it's not because they're not serving our target population, it's just the population isn't large enough to make those types of charges. So in those instances, reach out to us and we can help you identify the best stores. So once you've identified a good location, you want to talk to the store management. And one of the things that we have found is you want to make sure the manager and the person that you're talking with, they can actually make inventory and marketing decisions. All of the PSE changes we're going to be doing fall into those two categories, marketing or inventory. So if the person you're dealing with and have access to isn't the one able to make those decisions, then it's probably not the best store for you to work in. And of course, like we've said through all of the PSE training, you need to assess their level of interest. Are they interested in making healthy choices more available and more appealing to their customers? Or is it something that they are just really not interested in? A lot of people may not be, which is fine. I would say save your time and effort for those who do have some interest in providing that service for their customers. Another huge consideration is the size of the store. Think about, can you manage the size of the store with your allotted hours? Working in retail settings has a little bit more risk because there is a bottom line. There is someone's livelihood at stake, whether it's the store owner or just the success of the store in general. You don't want to be doing interventions that you don't actually have time to maintain that could potentially result in them losing sales. That's definitely not something we are wanting to do. So really be realistic and think about all of your responsibilities within SNAP-Ed, including direct education and reporting, and make sure before you approach a store it is something that you would have time to really commit to and fulfill your whatever it is you promised to them to be able to do. And your level of interest. This is something that I've forgotten to mention in the other PSE trainings, but when you're identifying which PSE strategies you want to work on, look at what you're interested in. Maybe you really love working with youth, so maybe working in schools would make the most sense. Or food pantries, if you're really concerned about the extremely food insecure population, then maybe food pantries is the better match for you and your interests. When you're working in an area that you're passionate about, the success of your program is likely to be much greater. So some key elements that we have seen in our program that lead to a successful store partnership or intervention, as well as in other states and programs, interventions, are partnerships are really important. You could look at the partnerships for Create Healthy Stores would include SNAP-Ed, our program, store owners, public health educators with the Department of Health, different community groups, and others. A really important part is educating consumers. We know that one of the many barriers of making healthy choices is people don't know how to buy or prepare or eat healthy foods. So having an education component to your PSE intervention is essential to increase the likelihood of those customers purchasing those healthy items that are available at the store. Marketing is really important. An important part of PSE change is making sure that people are aware of the PSE change. So using our marketing tools of signage and shelf talkers, posters, shelf educators, so that when you're physically not present, or the store manager, whoever your key stakeholder is in the store, customers can still learn about the program and know what those shelf talkers are and what those new healthy items are. Try to identify some incentives to the store. Sometimes you can get some community recognition and support for the store. You can get some excitement around the community that this store is really trying to promote healthy options for their customers. You could look at some media coverage or a kickoff event and do some good marketing of it to try to increase the number of customers coming to the store. And that will really help show the store owner that it's something that the community values as well. Looking at inventory improvements, so looking to help the store owner eventually source and stock healthier items. This is, as I mentioned, we're going to talk about stages of implementation. So this is probably something you would do towards the end, in the later stages of your partnership, just because there is an increased risk of them bringing in new items and perhaps they won't sell. So it's something you probably want to hold off on initially. Another type of inventory improvement that has less risk is healthy item displays. So looking at increasing the visibility and the appeal of healthy choices by using product placement strategies. And we'll talk about those in a little bit. You want to be able to provide training, so make them personalized to the store and to the workers. So that, again, when you're not able to be there, they're able to, maybe it's move the shelf tags around or talk to customers about the products that are available, or even just reach out to you when the recipe cards are gone or when the signs need to be refreshed and replaced. And then customer involvement. This was a great idea I heard from another SNAP-Ed state. They had these big whiteboards where they would say, what kind of healthy items do the customers want? And the customers could write on the board things they were interested in seeing. And once the store owner saw enough people write the whatever the item may be, they would bring it in, so that the insight and the input was coming from their actual customer base. So getting started, so after you have identified the store and thought about the key elements and think this can be something that's successful in your county, there's 2 steps to getting started. There's the store manager interview. This is available on our staff website. It's a very brief interview just to start the conversation with them. Talk to them about what barriers and facilitators they experience to offering healthy foods, so that you can understand where they're coming from and kind of their perspective of what they may or may not be willing to do. And also, what types of changes would they like to see? And we have a pick list to give them ideas of different things that we could help with as the SNAP-Ed program. And this kind of puts the ball in their court. It says, these are the different things we can do. What would you like to work with us on? Again, increasing the sustainability of these types of projects. In addition to the store manager interview, there's the store observation form. And as we've talked about in the other PSE trainings, this is our environmental scan tool. And this one is very brief. I have it on this next slide here, I think. Yeah, it's a very brief form, and it's designed to capture what they are already doing well, to start as talking points, but also to help them identify things they could do differently to improve the healthy food access in their store. You conduct these as a baseline, so as you start, before you do any of your changes. So you conduct one baseline and total a score for them, and then you do a follow-up when you're finishing your work with them or at the end of our fiscal year. And these are just things that SNAP-Ed we can help them work on, and things that research has shown to increase the purchase and intake of healthy food items. This would probably take about 15 to 20 minutes to complete. So it looks at types of vegetables, fresh vegetables and fresh fruit for sales, the shelf talkers or signs that identify healthy food. And then you go through and you actually rate the quality of the items that are available, of the produce that's available. And then the second page has you identifying what types of healthy food items they stock. So low-fat milk or canned fruits, baked potato chips, dried fruit with no added sugar. And a lot of these are, there obviously are some perishable items, but a lot of them are non-perishable items. So that would reduce the risk of them bringing in some of these new items, having a short shelf life, and then losing sales on them if they didn't sell right away, as people were still getting used to them being there. So like having baked potato chips next to the regular potato chips, just so those healthier choices are available. So that's our store observation form. And you can work with the store manager or, you know, whoever the key stakeholder is in that store to complete that, or you could complete it on your own. So once you and your store manager have identified what you would like to do, we have a variety of tools available to help you do that. We've got two main places where you can identify the resources available. We have our staff website with the whole PSE tab, and there's the thumbs up materials. And you'll see on the left-hand side of the page is all of the materials for the food pantry, and the right side are the things specific for the retail settings. There obviously is a lot of crossover between the programs, because ideally what we would like to start seeing happen is people would recognize these thumbs up signs from multiple locations. So if you work in a community where, and this would probably be in places that have multiple educators, maybe they go to the food pantry and they became familiar with thumbs up there, and now they're starting to recognize it at their convenience store. So they're starting to see it as a trusted source of nutrition and health information. So just increase, and the more that they're exposed to these types of interventions, the more likely they are to impact their choices at the pantry or the stores. So all of these marketing materials, or a lot of these marketing materials, I'll say you can order from our state office. We'll print them for you and send them to you. A lot of them we have available in English and in Spanish. There's a few things we don't have available in Spanish, but we're working on getting them translated. But in the protocol manual in section 7 under the Create Healthy Stores, that's where this table came from. And it describes all of the different options. There's 2 or 3 pages of materials you can utilize for Create Healthy Stores. It says how, you know, the intended use of each of the individual items, and then how to obtain them, either ordering from our state office, or there are some things that we just have you print in your county offices because they aren't things that are used regularly enough for us to do bulk orders of. With all PSE interventions, they've evolved a lot over time, this one included. So if you are in a store and there is something that you feel would be helpful to help improve this intervention, please reach out to us and we could talk about potentially getting that developed. And hopefully everyone knows about the supply order form, which is on our staff web. It can be accessed on the staff website under the CBH Ambassador Resources tab, and then you click there for your supply order form. And there you can order supplies for any program area for your direct education, so your surveys, your handouts, your PSE work, or your indirect. There's a lot of different materials there, so please be sure to check that out. So another resource we have is the Thumbs Up in Retail Settings Toolkit. So this is a step-by-step guide on how to implement thumbs up in retail settings. It talks about approaching the store managers and owners, available tools, the nutrition guidelines for identifying healthy choices, a healthy changes pick list, and then contact information for the health department. Again, as with all of our PSE interventions, we encourage collaboration, and the health department is just one of many partnerships you can establish to help these interventions be more sustainable and more easier to get started and to implement and maintain. So there is contact information for all of the local health departments throughout the state. So you can see if there's someone who is tasked in your region to work in retail settings. The nutrition criteria you'll find in the toolkit are how you would go through the inventory in the store and identify what foods could be tagged with our shelf talkers as healthy choices. So there are these types of boxes for fruits and vegetables, grains, proteins, and dairy products, but then we also have this snack food criteria, so that if they, you know, most convenience and corner stores would have a lot of these types of items. So these would help you identify which ones would be considered healthy choices. And you can see it's a lot of the nutrients of concern. So it's based on the amount of sugar or added sugar, the saturated fat, and the calories per serving, as well as sodium content for the salty snacks. And these are all listed in a per serving basis, so it should be easy enough to compare the nutrition facts label to the criteria to identify your healthy choices throughout the store. Once you identify your healthy choices, these are the shelf talkers you could use to help people quickly scan the store and see where the healthy choices are. As it was shown in a previous slide, we do have shelf clips available, a variety of styles to fit a variety of shelving types. We have these that kind of clip onto shelves. We also have some that can loop around the like wire shelves in a lot of stores. So if there's not something we have that fits your store needs, we usually will approve you to go and find something that would work, or you can work with us to locate something that would work for the types of shelving your store has. You could do things, these are our little shelf educators, make the healthier choice by choosing low sodium or no salt added vegetables. So you could put those up around the store to help people, to teach people little tips on how to identify their own healthy foods, whether it's at that store or others. One of the important things we talked about is making sure that customers are aware of the PSE changes and are aware of, as they're looking through the store and seeing these little thumb tags, what they mean. So we have these banners and grocery cart signs available for the stores. They are large hanging banners, or they can come in a poster size. So people know that those signs indicate foods that are high in vitamins, minerals, and fiber, or low in sodium, added sugar, and saturated and trans fats. So again, these can all be ordered from our office. This is the Healthy Choices pick list, which is available in the toolkit and then as just a printable document on the staff website. And these are different nudge strategies that can be used in the stores. And there's 3 different categories. There's product placement, product promotion, and product availability. So you could take this to the store owner and go through, these are all approved things for SNAP-Ed to help with. So you could take this to them to generate ideas of where they want to start. We generally suggest that people select between 1 and 3 goals to start with. And then as those are completed, go back and select another 1 to 3 goals. But you can bring this to the table and say, is there anything here that you would be interested in working with us on? And if they have, it might just kind of give them ideas to start brainstorming of some other ideas that they might be interested in. So product placement ideas are things like offer ready-to-eat fruits or vegetables right at the cash register. We know those impulse buys happen, so taking away some of the less healthy options and replacing them with some healthier options for those impulse buys may increase the sale and the intake of those beneficial foods. Display water or other low-calorie drinks at eye level in the refrigerated section. So just moving that bottled water to an eye level may increase the sale of it. Product promotion strategies are promote all the healthy foods and beverages using the thumbs up signage on shelves and refrigerators. Offer recipes for healthy products throughout the store. Place the recipes close to the foods they utilize. That's a good way to get started. Ask the store owner if there's something that they don't sell a lot of, and if it's something that they already stock. If it's something that fits our nutrition criteria, you can help move it by offering a recipe that people can just take as they purchase it. And then product availability strategies is just increasing the number of healthy options. So maybe they're looking at some whole grain products. Maybe they have a couple of types of pasta, just boxed dry pasta. And one of those types can now be a whole grain pasta. Or having at least 2 healthy snacks like whole grain pretzels or the baked chips we talked about, or an unsweetened dried fruit in addition to all of the other things they offer. And another reminder, just with all of these strategies, you don't necessarily have to limit the other options that are available. That's the nice thing with nudges, is that you don't want to take away people's choice. You just want to make those healthy choices the easiest choices to make. So you want to add healthy options to it rather than taking away some of the other ones. I mean, if you meet a store owner that wants to reduce the amount of unhealthy foods they have available, by all means, but I think you probably won't find too many people that want to reduce their inventory, especially things that sell well for them. So I referred to the implementation stages earlier on. And again, when you're talking about retail settings, there is someone's livelihood at stake. So I would strongly suggest starting your program with increasing the visibility of healthy choices that they already have available. So using the marketing materials, the posters, the shelf talkers, the shelf educators, and maybe it will only be bottled water and some granola bars that fit our healthy choices, our healthy guidelines. That might be the only things they have in the store. So if that's it, then those are the ones you want to start pushing. And maybe the store owner hopefully would see an increase in those sales just by display changes and promotion of them. That would make them likely to want to try a couple of different strategies with you. And then once you are doing some of those less risky things of just promoting and moving around items they already have, then you can start the conversation about increasing the availability of healthy choices within the store. There's a program out of Iowa, I think it's Iowa, that the first thing they do when they're talking about inventory changes, they just bring in bottled water. So if the store already has bottled water, maybe you would work with them to find a cheaper bottled water so that that could be the least expensive beverage in the store. It's pretty low risk. There's not, it's not perishable. It has a long shelf life. So just making that simple change of having bottled water available is a good foot in the door for when you're starting to talk about changing the inventory of these stores. Whole grain products, again, often pretty long shelf life, or less perishable items than fresh fruits and vegetables. So lower risk than things like fresh produce. Looking at low sodium canned goods, seeing what they have. Maybe they have a few just prepared soups that they sell. Looking at maybe bringing in one low sodium option. And then the last one you'd probably start looking at are the fresh fruits and vegetables just because of that short shelf life. And then when you do bring them in, using a lot of those promotion and placement strategies to really help the movement of them, like having them right at the cash register. Another essential part, just like when you're doing thumbs up in the food pantries, is to have the education booths in these stores. You can teach topics like how to make the healthy choices, how to utilize that thumbs up program, why healthy choices are important. You can give them little tidbits of information of the importance of reducing added sugar and reducing sodium in the diet. This is a great place to do the Think Your Drink, where you do the sugar content of popular beverages. Definitely want to get that one approved by the store owner. It might be looked at as, trying to get people not to buy those items. So you would definitely want to talk about to the store owner about the nutrition tidbits you were wanting to share at your booth. But if they were open to it, that would be a great one to offer in the store. Doing recipe samples, so featuring items that are available at the store. So again, if they have some whole grain pretzels or some baked chips, just offering samples of them. And we can use our SNAP-Ed dollars to buy those items at the store to sample them to customers so that you are also supporting the store. You always, obviously, I just kind of mentioned this, feature items available at the store. So you wouldn't want to bring in items that they don't have and promote those, because that wouldn't help increase sales of that particular item. And when you're doing these booths, you really want to think about creating a regular schedule. Maybe you just go once a month on the second Saturday or the second Wednesday, whenever they have a lot of customers coming through to have your booth. And you could advertise that you're having those booths to try to increase the customer base there. Advertise them at your classes and at the other events you're at. You could also do the prepackaged or recipe bags like we do in the food pantry, and you could work with the store owner to get one price for those meals. Maybe every Wednesday, second Wednesday of the month when you're there, they know you're going to have small bags of dinner that people could buy for $8 or whatever the price would be. And again, only using ingredients available at the store. So depending on the size of your store, that could be challenging. So these are a couple of photos from some of our successful interventions over the last couple of years. The top one is a store in Salt Lake, and the owner said customers are noticing and commenting on system-wide signage throughout the store and are asking about it. We tell them it's good for health. People are now picking up the items and looking for information. And then another owner said we have to educate customers on their choices. There's a lot of obesity and we have to do something to educate them. So those are both good examples of people who champion the program and who are just invested in this type of work. So they were great people to work with. And then the other photo is some of our educators. They had a booth at a convenience store down in Salt Lake, and they were doing flavored water and I think a trail mix that they made with popcorn and dried fruit and a couple of other items that were available at the store. And you can see they're also recruiting for classes in the community. So a great combined effort. We had one store that it was actually a partnership with the health department down in Weber County. They implemented thumbs up at a larger grocery store, and they were actually tracking the sale of items in their checkout lanes with the thumbs up labels, and they actually saw a 55% increase in the sale of those items. So a good example that these programs not only benefit community members, but they can also benefit the store's bottom line. Okay, and then finally, create healthy stores PEARS entry. So as with all of the PSE strategies, there are detailed instructions in Section 8 of the protocol manual. But I'll just kind of go through some highlights here. There's one PSE entry per store. So even if you're doing multiple interventions in one store, you would just do one PSE entry and capture all of that work you're doing in that PSE entry. You'll update the entry throughout the year. So as you go through the year and make your changes, maybe start with your marketing changes, and then 6 months in, you start with some of your inventory changes, you'll capture all of those in that entry. And you won't mark it as complete until the end of your work or the end of the fiscal year. You can't really say this is exactly how you would complete your PSE entry because every PSE strategy is slightly different because there's lots of different interventions and changes you can make to different locations. So these instructions are just intended to give you ideas of how to think about each of the questions throughout the module. One of the things you'll definitely want to do is in this strategy section, you're going to be looking at the complementary activities. And throughout our PSE activity or trainings, we've talked about using many of our different program areas to support each other. So doing direct education and a PSE and an indirect all together. And this is where you would capture that. So if you're doing PSE in a store, you're obviously filling out a PSE entry, so that covers your reporting of that piece. But down here in strategy, if you were also doing booths to recruit customers to classes and to tell them about the Thumbs Up program in the store, you would select this marketing, advertising, and promotion section in your PSE entry, just to show that you're not just doing PSE there, you're also doing some marketing. Or if you're doing trainings of the staff in that store on how to be able to continue the program without the assistance of staff ed, you would select the staff training. And for all of these sections, because the developers of this program to capture all of our results know that people are going to be doing PSE work throughout the year in this site, you'll be able to continuously add to it. So maybe the first time you're in there, you just click marketing and advertising. The next time you go and you'll be able to also click the staff training, and it wouldn't take, it's not a just select one option. Changes adopted, these will just depend on what strategies you and the store owner pick from the pick list. But you can see here there are different, if you chose some of those product placement strategies, these are some of the adopted changes you would likely select from the drop-down menu in PEARS. Reach, this one's probably pretty difficult for the store, kind of depending on the way the store runs. Some stores may have a pretty good sense of how many people they reach in a week or a month or a year, how many customers they have. So work with the store manager to do that. Always make sure you're probably in these settings, I would say almost always, if not always, you would just have an estimated reach. They probably don't know the exact number of people they are reaching. So make sure you select that estimated from the drop-down menu of how you determined the number of people you're about to report. And for most PSE efforts, there is a section where there's the characteristics of those reached, which would be the demographics or the ethnicity, the race, the age, the gender of those reached. You can just put unknown unless you have that data from something. I certainly wouldn't take the time to try to go in and guess how many people or the characteristics of those reached. So just selecting unknown is completely fine there. And then the rest of the sections are pretty self-explanatory. If you have questions, feel free to reach out to us. And then again, you would mark it as complete at the end of your work with the store or the end of the fiscal year after conducting your follow-up score with the store observation form. So that is the overview of Create Healthy Stores. Are there any questions?
Actually, I do have a question.
Okay.
Just about, you said getting like marketing or not marketing, but like a news coverage for the store that implemented this program.
Mm-hmm.
Where's the line between getting the like news in there and then us like incentivizing their store over other stores? Like where's that line?
Yeah, that's a really good question, Hiram, and it is a fine line. What I probably would do is just look to get coverage of the of like a kickoff event, or so you're not deterring them from going to other stores. You're just talking about a new program this store is offering. So I would definitely recommend working with your supervisor on that, if not those of us up here at the state office. But that's a good question. It's a fine line that I don't really know if I have a great answer for, besides working with your supervisor and with LaCee and myself here at the office.
Okay, so if we were working in a place like that, would we then not mention it, for example, in our classes? We couldn't just say, oh, well, at this store we're doing this, or is that okay?
Yeah, you probably wouldn't necessarily want to do that.
Okay, great. But we could say that while you're grocery shopping in certain stores, you can look for signage that might promote healthier food options.
Absolutely. Yeah, it is a hard line to toe, but yeah, that would be great to just make them aware of the presence of that program in the community.
Awesome, thanks.
Yeah. And a great way to do that is to like recruit for your classes from those stores, and really just trying to identify those best stores where you know a lot of our target population is going. Any other questions? Okay, well, thank you, everyone. Enjoy your day.
Thank you.